Thank you for watching this Workplace Learning Connection presentation. In this video, you'll get a quick introduction to 3 specific healthcare careers. We will focus on careers in nursing, medicine, specifically on a career as a doctor, and finally, we will discuss careers in mental health. This video gives a high-level overview of each of these careers. If any of these careers spark your interest, you can view the speaker's full presentation by going to our YouTube page, Workplace Learning Connection-Kirkwood. Let's start off by learning about careers in nursing from several local nurses.
What is a nurse? We are the eyes and the ears for the doctors. When you go to a doctor's office, the doctors will come in and see you for a very brief period of time. And the nurses are there the whole time. We need to know when things change. We need to notice little changes by doing things like taking your vital signs like blood pressure, heart rate, your temperature and oxygen levels. We give you the medications. We see how you react to the medications. We're always assessing the patient every shift and sometimes multiple times a shift. And then we also get to help the physicians with bedside procedures as well. So where do nurses work? There's a lot of places. The first places you probably think of are the hospital and doctor's offices and clinics. You can go into any branch of the armed forces as a nurse. You can work in research labs. That is a career path that would take you away from the bedside. You wouldn't be working directly with patients, but it is very important. Nurses can work anywhere in the world. Just because you went to school here doesn't mean you couldn't choose to move to another country and be a nurse. It really is a universal profession. So one big question that I always get is, how much does a nurse make? And the pay is actually pretty good. The average starting salary of a nurse in Iowa is between $23 and $27 an hour. And depending on what kind of education you have, what specialty areas, and what experience you have, the pay can get even better. How do you go into nursing? There's a lot of different educational routes as well. There is an associate's degree, which is an ADN, that is a 2-year degree. There is a BSN, which is what I initially got. That is a 4-year degree. There's a master's degree, which is another 2 additional years, and that you'll start going into more specialties. So I have a master's in nursing education. And then beyond that, there is a doctorate degree. So a DNP is what most people get, which is a doctorate in nursing practice. That's an additional 3 years on top of that. And those nurses actually act as mid-level providers. They can do almost anything a physician can do under their guidance.
So what can students do now if they are interested in becoming a nurse or working in healthcare?
Nursing, there are a couple ways that you can enter the nursing field. You can start by getting your certified nursing assistant CNA. This would open up job opportunities in both hospitals or home care or long-term care. The education is a state-approved program, and it takes you through the training of some basic nursing skills. This is a really great way to enter nursing. I highly recommend, if you think you want to be a nurse, that you start as a CNA. It puts you at the bedside and really gives you an idea of what nursing is. Healthcare does have a lot of opportunities outside of nursing. We need people that enjoy IT and are really computer savvy. There is an informatics realm in healthcare that you may also find. If you're still really driven to nursing, but you enjoy the computer component, we have nurse informaticists, and that's the best of both worlds, where you get to help influence the build of the medical record that we use with the knowledge of nursing. We have robotics in the OR that we use for surgeries. Helps keep things less invasive, and so you're able to go home sooner with a faster recovery. But in order to have the robotics in the OR, we're going to need engineers that can design things.
Now let's learn about what it's like to be a doctor. As you probably know, doctors are people who are skilled in the science of medicine and are trained and licensed to treat sick and injured people. Let's hear from a local doctor on her career.
To talk a little bit about what's involved in becoming a physician, I really like to look at it as a marathon, and that, there's a lot of material to learn, especially if you want to take really good care of your patients. And so because of that, you have to dedicate several years to doing this. After college, I then went to medical school, and within medical school, the total amount of time that you're there is 4 years. For the first 2 years, there's a lot of kind of book work and classroom work where you're learning about how the body works and learning about different disease processes. And then near the end of your medical school is when you start to experience patient care firsthand. So you have the opportunity to rotate through a whole bunch of different specialties, like anywhere from pediatrics to surgery to neurology and psychiatry. So you learn a lot about a lot of different aspects of medicine. And near the end of your medical school is when you decide what specialty that you want to dedicate your practice to. For me, that ended up being dermatology. And then after that, I did 3 years of dermatology residency. After that point, I graduated and became an official dermatologist, but was hungry to learn a little bit more about my specialty. I had a very strong interest in doing procedures, so I did an additional year of surgery. When I was going through medical school and trying to decide why dermatology, I had never rotated through dermatology or never followed a dermatologist. And so in my mind, I thought dermatology was just acne and psoriasis and eczema or warts. And I wasn't quite sure if that's what I wanted to do and why I went through so many years of training. But what I found is that it's so important to actually experience and shadow and actually see what a specific specialty is about before making a judgment or a decision.
Let's hear about a few careers in mental health, starting with the career as a psychiatrist.
Psychiatrist is a medical doctor, so you do medical school at an MD or DO, which is a doctor of osteopathy program, who specializes in mental illness, which specifically means that you have the medical training to take care of both mental and physical aspects of psychological problems. So we spend most of our time diagnosing mental health problems and then prescribing treatments. So what's the path to becoming a psychiatrist? There's a whole bunch of paths. First, you want to graduate high school. Then you do need to complete a pre-medical track in college. And so college is usually 4 years for most people. Medical school is another 4 years. You get training in anatomy and just basic medicine, and that's where you get your medical degree or your MD. And then you choose a specialization. So you can become a general medicine doctor or a psychiatrist or a surgeon. And each of those trainings is different amount of times. And then a lot of people will just go into practice, whatever field they're in. So a lot of people will go practice psychiatry after this amount of training. I actually came to the University of Iowa and did a fellowship, which means you get even more training. So it's a lot of years, but that was where I learned brain stimulation treatments specifically for psychiatry residency. If it's something you're interested in, your ultimate end goal is becoming a doctor, but something you should be enjoying along the way, and it's hard work, but if it's what you want to do, this isn't wasted time, it's just great training time. So why do we need psychiatrists? For a few main reasons. One, we don't have nearly enough of them. You can see in this top right image, this is the number of mental health providers in the US compared to some other countries. And pretty much other than Sweden, we have less mental health providers per capita in the US. The other main thing is that we're not doing a great job of managing these conditions. So suicide is on the rise, depression is on the rise. Unlike most conditions that we focus on in medicine, we decrease the rates. That hasn't been successful in psychiatry, unfortunately. So we need more people studying this and more people treating these patients. What's the difference between a psychiatrist and a psychologist? This is a great image showing some of the differences. I would say psychiatrists have medical training, so we deal with physical and psychological problems and prescribe medicines. Psychologists have extensive training in psychological testing, so using different psychological tests to inform diagnoses, and then also doing different types of therapy. And psychiatrists do therapy as well, and it just kind of depends on the practice you get into. Both are experts in diagnosing mental health problems.
Lastly, let's hear from a local psychologist on her career field. What do you do as a psychologist?
So clinical psychologists, if we're thinking very broadly, diagnose and treat psychological difficulties like attention deficit hyperactivity disorder, or ADHD, depression, anxiety, post-traumatic stress disorder, and all these types of psychological or mental health disorders. We often also work with individuals who don't have a disorder or any sort of diagnosis, but maybe going through a time of life that's extra stressful. And one of the main things I do is psychological assessment. This basically means I do different tests with people to determine things like IQ or intelligence, to determine whether somebody has difficulties with learning or with memory. And I also can give or administer a lot of questionnaires to help determine differences in personality or whether somebody is having issues with symptoms of depression or anxiety. I also do what we call psychological intervention, which is more commonly called therapy. We also conduct research. So we are looking at reasons why people experience mental health difficulties and the best ways to treat those things. If you want to be a clinical psychologist, what do you have to do in grad school? It's more school for sure. It's at least 4 to 6 years of education after your bachelor's degree, so after 4 years of undergrad. Final year of clinical psychology, it's kind of like doing a residency for medical school. And after that, I get to decide if I want to stay in academia, which means staying at a university and being a professor and teaching as well as doing research and some clinical work, or if I want to go private practice and just do clinical work all day. So let's say you're interested, you're like, this sounds cool. What should I do right now? Number one thing I think is volunteering. Volunteering always is helpful, and the places that I would suggest you volunteer right now to see if you do want to work with individuals with mental health problems would be a homeless shelter, United Action for Youth in Iowa City, signing up with United Way, or the Rape Victim Advocacy Program, or the Crisis Center. I would suggest shadowing somebody if you can, and then take some sort of introductory psych course.
Thank you for watching this video on healthcare careers. This is not meant to be an inclusive list of all careers within this pathway, but we hope one of these clips may have sparked a potential career interest. If so, please visit our WLC YouTube channel by clicking the link in the video description to view a library of all our career speaker recordings.